I am a 64-year-old male with thinning hair, about 65% left on crown, top, and receding hairline. Would PRP restore or help?
Thank you for your question. You're 64 years old. You state that you are thinning and that you are under the impression that you have 65% of your hair still present throughout the scalp, and you're asking, will PRP help restore or improve your appearance? Well, I can certainly give you some guidance on how we answer this type of question when people come to us in our practice. I'll give you a little bit of background. I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice for over 20 years in Manhattan and Long Island. I'm also the founder of TrichoStem Hair Regeneration Centers, a system we developed in our practice where we use PRP as well as ACellular matrix in a way that non-surgically successfully helps 99% of men and women with genetic pattern loss, such as what you're describing. So I have a lot of experience with PRP. In fact, we use PRP in our practice for a lot of indications, from skin texture quality, scar revision, acne scars, for wrinkles, for under-eye dark circles, and in the context of our solutions for hair loss. So let's begin with first answering the question about whether or not PRP helps hair loss. Now, this is a question that has an answer that is somewhat measured, especially because you did not submit a photo. But I'll explain it. Platelet-rich plasma does stimulate hair growth. However, the limitation is the number of hair follicles and how much your hair will respond. Because in my experience, when people go for platelet-rich plasma injection for hair loss, they need to go at least once a month, if not once every 2 to 3 months, to keep getting the injections in order to sustain some growth. And when you stop the injections, the growth stops as well. In our practice, what we have is a solution called hair regeneration. Now, in a situation where you describe, let's say that you do have 65% of your hair. Well, how many follicles are there on your scalp that are salvageable? And what stage of hair thinning are the rest of the hair follicles? With hair regeneration, we're able to stop progression. We're able to reactivate hair that's not been growing, which is characteristic of pattern genetic hair loss, where hair is in a prolonged what's called telogen phase, and we're able to induce thinning hairs to shed so thicker hairs grow in. This treatment is actually usually a one-time treatment. We do the injection and patients come in for follow-up every 3 to 6 months, and in some situations for more advanced hair loss and some not so advanced, we'll do another injection somewhere around 15 to 18 months. There's a big distinction between hair regeneration because we're employing this material called ACellular matrix, and we have figured out over several years an algorithm that takes into account age, progression, level of hair loss, gender, and other variables that we've figured out over many years. We have patients who come from all over the world, and so we certainly have more than enough experience, and we do a lot of these treatments. So I think that you should meet with doctors. I would question that whether or not you really have 65% of your hair. It is commonly accepted in our field that when someone notices hair thinning, they've already lost 50% of their hair. You may have thicker hair, which means you have good coverage, but you probably don't have necessarily 65% of your hair. If you do, that's fantastic. It just gives someone like myself more to work with and better results. And that brings home the last point, which is the more hair that we have to work with in terms of hair follicles, the better it is because we have something to work with to regenerate. Once a hair follicle is gone, it's gone. So in answering the question about being able to recover, essentially when you think about hair thinning, if you have a frontal or temporal recession, last one out is first one back in. The temporal areas in the furthest point will start to come forward. If it's crown area, well then the fringe goes inward, goes from in to out when you're losing hair, it goes from out to in when the hair is coming back. So the more you have to work with, the better it is. So I would say learn about the differentiation between PRP alone and this technology that I described called hair regeneration. So I hope that was helpful. I wish you the best of luck. Thank you for your question.